Hello, I'm Dr. Pallavi Vasal, consultant obstetrics and gynecology. I'm practicing at Gurgaon. Today I'll be talking about polycystic ovarian disease. Now, polycystic ovarian disease, we must have heard a lot about it because it is becoming very rampant nowadays. Every you throw a stone and the girl is known to be suffering from polycystic ovarian disease. The incidence is as high as 1 in 10 to 1 in 20 in the women nowadays. Now, why is there a sudden rise in the polycystic ovarian disease? Now, it is a lifestyle disorder. The lifestyle, you have to maintain a very healthy lifestyle, otherwise you screw up your lifestyle, your hormones are going to be screwed up and you suffer from polycystic ovarian disease. In polycystic ovarian disease, there are changes in the levels of the hormones, the sex hormones, the estrogen, progesterone and androgen. And the basic net, it starts from the level at the level of the insulin. So, it is a part of metabolic syndrome. So when the insulin gets screwed up, it leads to increase in the levels of androgens. And there is this androgen, it is a male hormone and that screws up the normal ovulation period, because of which the ovulation is not happening and the periods are not coming regularly. So it becomes a vicious circle. Once you gain weight, because of there is rise in the levels of insulin, it leads to disturbance in the sex hormones, and further disturbance in the hormones leads to further gain of weight. And so we have to break the circle to treat it. The symptoms, now that we coming to the symptoms, the usual symptoms are like irregular periods, increase in the hair growth over the face, chest and body. There is difficulty in tremendous difficulty in losing weight. So despite putting in your efforts, you will find that you need to put in extra efforts to lose weight. There is increase in the loss of hair from the scalp, increase in the growth of hair over the chin and over the chest, and there is increase in the width of your size of the belly size also, it increases. Now with gain in weight, it becomes a issue. So we need to, first of all, we need to see why all this is happening. Now diagnosis, regarding the diagnosis of polycystic ovarian disease, so diagnosis, it depends, it is a combined diagnosis of history, the laboratory examination and the ultrasound finding. Not all the three features should be present before we make a complete diagnosis of polycystic ovarian syndromes. In the lab test, we do the hormonal workup, the insulin levels, the female and the male hormones are checked, and in the ultrasound we look for the criteria which meet for the polycystic ovarian disease. Regarding the treatment, as we discussed, it is a lifestyle disorder. You keep your lifestyle in check, your things are going to be checked. Now, healthy lifestyle. Healthy lifestyle means eating healthy, avoiding exposure to endocrine supplements, substitutes, like coming in contact with things which are like strong perfumes, home cleaners which have very strong odors, things which contain preservatives, and things which have xenoestrogens, particularly like using using plastic bowls, pouring the hot things in the plastic bowls, using preservatives, canned food. These all they cause disturbance in your hormonal level. Thirdly, keep your weight under check, so the hormone levels are going to be in balance. You should avoid any kind of physical and psychological stress, and exercise is a mandatory component. Whether you are able to lose weight or not, you should exercise regularly if you are suffering from polycystic ovarian disease. Now, regarding the treatment, the medicines, we divided the patients in two categories: one who want to conceive and one who do not want to conceive. The one who want to conceive, we advise the lifestyle measures first, but if with the lifestyle measures, if they are not able to overcome the issue, then we have to give them a couple of hormones so that the ovulation stimulates and more number of eggs are formed, and so that they are able to conceive. Now, the one who do not want to conceive, now again for them the lifestyle measure is the first treatment, and then we start with oral contraceptive pills which are to be given like regularly. These oral contraceptive pills, which are specifically meant for PCOD, they contain a salt which reduces the male hormone level and corrects the hormonal disturbance. Now, very frequently we need to add insulin sensitizers also, like metformin. Metformin has to be added to correct the insulin balance. And sometimes if the hair growth is very excess, we need couple of medicines which decrease the male hormone level which are called anti-androgens. Surgery is the last resort. It is usually done in patients who want to conceive, and despite all the medical treatment they are not able to conceive. In that case, surgery is done, in which we do it laparoscopically, and the ovary is drilled at 3 to 4 points to decrease the levels of male hormone. Now, if we go into the long-term complications which can happen after the polycystic, once you develop polycystic ovarian syndrome, is like you can have difficulty in conceiving, which is called infertility, development of hypertension, diabetes, high cholesterol level, heart attacks, anxiety, depression, sleep apnea, and during the menopausal age group, if the estrogen level is very high, it leads to formation of endometrial cancer and breast cancer. During pregnancy, there is, if the patients who with PCOD, when they conceive, they have increased chances of miscarriage, developing gestational diabetes, and premature delivery. So I would say keep a very healthy lifestyle, beware, keep a check on what you are eating and how you are exercising. For any further query, you can come to me, connect to me, and through Lybrate, or you can make an appointment with myself.